Hi, my name is Sue Ellen Barnum. I'm the chair of the MRI program here at Owens Community College. So first thing I want to go over is some myths about MRI. The first myth I have here is the MRI is only on when it is making noise. That is a myth. The MRI is on all the time. The magnetic field is there always, whether it's making noise or taking pictures or not. So that is myth number one. Myth number two, I'm pulling off my list here. I had an MRI before and the machine goes around and around. We hear patients say this a lot. And what you've actually really had, if this was a patient telling me this, is that you've actually had a CT exam. So not an MRI. So that was a little bit different. That is also a myth. Myth number three that I have on my list. MRI has radiation in the exam and I don't want to have it done. MRI has no X radiation. It does have some RF radiation, but it is non-ionizing. So it does decrease some risk factors by not having ionizing radiation. Myth number four, MRI only takes images of the brain, and that is false. MRI is developing more and more all the time. It is becoming better and better, faster and quicker. So MRI is doing imaging of the entire body, even the heart. Something we used to never do before is now being done on a regular basis. Also, people with pacemakers. If I have a pacemaker, I cannot have an MRI. Now, that is another myth. Pacemakers are being presented into the MRI scanner often. It's usually in a controlled environment. So there's nursing staff there, there's a physician there, there's maybe a maker of the pacemaker there, but pacemakers are now MR compatible. All right, and my last myth. MRI will pull metal right out of the body. That is not true. You will not adhere to the MRI machine, nor will you have things flying out of your body. Only if they are loose in your pockets, maybe. But say you have a piece of metal in you from a previous surgery or something like that, we do have to make sure that it's MR compatible. But if it's been there a while and we find that it's MR compatible, it would not be pulled out of your body. If it's something, we do worry about things heating up or also torquing or twisting just a little bit. So those are some myths on the MRI machine and procedures.